Jim Roop, Westwood One News.
Governor, thank you very much for taking our calls. I truly appreciate it. Just circling back a little bit on the legislature, the Assembly Public or Assembly subcommittee on the budget met yesterday, and there was a lot of questions on both sides of the aisle about the money. And as I understand it, the money that's been spent, the $2 billion so far, is what they were talking about, and you're looking for $5 billion more, or you anticipate the possibility. They really grilled Teresa Calvert yesterday. You got to give her a lot of credit for how she took all of that. But my question is this coming from the reserve fund, the $19 billion reserve fund, or is this coming from another place? Where's this money coming from? I think that was some of the confusion yesterday, too, and you're right. Lawmakers are getting a lot of questions, they tell us. So what is your response to them about where the money is coming from, where it's going, what are the resources that have been purchased, and where are those resources going? I guess those are the questions that they talked about yesterday.
Right. So every dollar that we spend, we're accountable for, and we're very grateful for their oversight and their collaborative capacity to guide us through that process. As you know, the legislature, to their credit, afforded this administration $1 billion of emergency aid from the state's general fund. That included $100+ million to provide for support for distance learning and for PPE and deep cleaning in our public education system. That $1 billion we've distributed in a very transparent way. I make the announcements to you and to others at these daily news conferences. We talked about the work we've done on child care, $50 million. Work we did on foster care, $42 million. The work we did on workforce development, $17.8 million. We've laid that out. I can continue to walk down that path in very specific terms, and we provided that information to the legislature. What you're referring to is the totality of ask that we anticipate above and beyond. The vast majority of that, 75%, will be reimbursed by the federal government because of the authority and relationships we have developed with FEMA. And that reimbursement will ease, I think, a lot of the stress. However, it all requires oversight. And it requires the appropriate dialectic of the engagement that you saw over a 5-hour period yesterday at a hearing. That's what legislatures are for. And so we look forward to continuing to engage in that spirit. It's been difficult for everybody because legislative session's not in. They're doing these virtual meetings, and now they're doing a little bit of a hybrid with some people physically there, others on the phone. And obviously it's not an ideal situation for any of us, but we'll continue to work in that spirit of collaboration and also the spirit to which the legislature advanced by providing me the emergency authority with that appropriation and the utilization of a disaster emergency recovery fund, which also was supported in last year's fiscal budget for exactly these kinds of emergencies, which is the second tranche of money that we have been utilizing for these purposes.
Vicki Lorenzo, Fox 40.
Hi, Governor. Thank you for taking my question. I'm wondering about the collaboration with the federal government right now as Congress works on another round of stimulus. And one of the sticking points was states and local municipalities getting more money. Do you have the speaker's ear? And even when you talk to the president, are you able to really lay out what California needs, considering we are the 5th largest economy?
Yeah, it's a wonderful question. Not only do we have the speaker's ear, we've been in constant contact with the Speaker's office for now months since this pandemic first became very real to us in late January with those repatriation flights from mainland China. That collaboration was strengthened in the Speaker's office beginning then as it relates to this disease in particular. We worked with the Speaker. I put out a letter specifically requesting resources, not only for the state of California, but putting the magnitude of what I believe is going to be the needs for this nation as it relates to governors and city administrators and city managers and city leaders. That was $1 trillion request. And I actually believe that may be modest in terms of the totality of this challenge. I'm appreciative that Senator Menendez has got a bill, bipartisan bill, with Senator Cassidy for $500 billion rather, for $500 billion in that space. That's real progress. It's just a bill that they're promoting. But the work with the Speaker is more prescriptive in this respect, and it, I think, goes to the spirit of your question. The CARES Act, the $2.2 trillion that came down in the state of California, we were the beneficiaries of about $15.3, $15.4 billion as a state. $6.9 billion of that to the largest cities in the state, but just 6 cities with population north of 500,000. I don't know what the number is, but I can't imagine there's more than 40 cities around the country with a population north of 500,000. So I think people all across this country were hopeful, particularly those smaller municipalities, that the next round of stimulus will consider those smaller jurisdictions. In California, just to put that in perspective, only 17 of our 58 counties were able to get the benefit of that local support, not just our cities. So 6 cities, 17 counties. So we're hoping to bring that down from 500,000 to 50,000. And that's specifically kinds of conversations I'm bringing in to our private conversations with the Speaker's office and other people. The good news is I think this is broadly shared across the spectrum. The challenge, of course, is the more money you put for cities, the less for states, and we don't want to be in this awkward dance of fighting for limited resources, and that's why we put out what we believe is necessary looking out over the next few years at the unemployment rates, looking at the trajectory of where we think things will go. We put out that marker of $1 trillion. So that's the answer. Question, yes. Couldn't be more blessed by Speaker Pelosi's leadership. She's been masterful, and we couldn't be more pleased hearing the progress on the PPP extension, which is just fundamental and critical to keeping businesses alive so people have a place to go back to work when we get through the worst of this pandemic.
Katie Orr, KQED.
Governor, the California Nurses Association reports that there have been hospitals who are holding on to their PPE and not giving it to nurses and medical staff to actually use because they're preparing for a possible surge. But in the meantime, the nurses are not properly protected. Have you heard about that? What's your response? And then how do you ensure that the PPE actually is getting to the people, not just the hospitals, but the people who need it?
Yeah, I had another one of those Zoom conference calls and heard that directly from leadership, the California Nurses Association. I quite literally said the following: give me the CEO's cell phone and I'll call, because that is an outrage. Our nurses must be prioritized. Their health is more important than the health of people like me. They must be prioritized. The reason I won't wear an N95 mask until every nurse in the state of California has an N95 mask, has a procedural mask, has appropriate gowns, coveralls, shields. They deserve it. They're the heroes in this pandemic. And so forgive me for being a little forward. The answer is yes, I've heard it. And I've heard enough of it as well. And what I mean by that is it is the spirit of why we went out to get this large contract, which you and others have written and discussed a lot about, including the legislature. And we are very hopeful in the next few weeks that we're going to see millions and millions of additional PPE masks, new units of PPE into the state of California, and we're going to get those out as quickly as possible. The numbers we gave the legislature on Sunday that were socialized yesterday, on Monday, were 42.8 million N95 masks, some 3.3 million procedural masks. We actually gave them the information by county so they can see where they are going within the counties. But we have very prescriptive protocols, and we are really running herd over those protocols of how we distribute these down to the hospital systems. And then what happens within the hospital system is where we're trying to get under the hood so we don't hear stories like that anymore.
Final question, Angela Hart, Kaiser Health News.
that you would accept help from the federal government to ramp up the testing as you have called for. And we'll be looking for details on that tomorrow. But I just wanted to find out from you today, what specifically do you need help from the federal government with? What supplies, what testing procedures do you need help with? And what can California handle on its own?
Yeah. Well, we did a survey. Well, I'm going to get a little ahead of my skis. My staff that's in front of me behind this camera is probably not going to be pleased, but we did a very detailed survey of all of our testing providers, and I'll do justice to their concerns as they're moving closer to me. Forgive me for bringing you into this room. Tomorrow, I'll give you the results of that survey that will answer the question. But let me just, for the purposes of generosity of your question and my responsibility to be transparent to you, it will not surprise you, swabs and transport media remain the dominant need, but it's not exclusive to swabs and transport media. It also goes back to the old reagents, the RNA extraction kits. Those remain issues. We've been very pointed in our private conversations with the administration. They know this and continue, as I said yesterday, that yes, to the federal government, we need more of those supplies, but we're not just going to sit on our hand in the absence of that. We're not going to complain about it. We're not going to point fingers. There's plenty of fingers being pointed in every direction with this pandemic, and I just, let's put our hands down. Let's open our fists and let's open our hearts to all of us trying to work more collaboratively together to resource the needs of 300+ million Americans, 40 of which million live in the state of California. And so we'll continue to search high and low and continue to make progress in this space. And you're going to hear a lot more about that progress tomorrow. So look, I want to thank, as always, thanks to everybody that is tuning in and watching. And moreover, I cannot express my gratitude more to Josh Friday and his team for this wonderful effort to really get our volunteer efforts in the state of California at a whole new level. Please, please, if you're sitting at home and you're wondering how you can contribute, you're wondering what you can do to help those in need, put a smile on your face if you're not feeling particularly good about the moment and you're feeling a little bit down, you want to lift that spirit, you want to lift someone's heart, here's your opportunity. Check out californiansforall.ca.gov. Stay home, practice physical distancing, stay connected, and check out that website. Take care, everybody.